Now is it even better? Thank you. I've been a member since I think September or so. I have peripheral neuropathy. I got it from chemo, and did a ton of research on what can help. I'm sure most of you who have neuropathy have asked your doctors, and there's a wide array of answers that we get from the medical community about what can and can't help. One of the things I came across was massage therapy, and I looked for someone in Austin who was qualified at to do massage therapy for neuropathy. Came across the Oncology Massage Alliance and met Wendy and Susan, your speaker today, Susan Prins, and I've gone to her several times for my neuropathy in particular, and it is a wonderful, wonderful thing to do for yourself. It feels so remarkably good while you're there and throughout the week, and it helps me mostly, I think, with my attitude about my neuropathy. It gives me something to look forward to, and the days that I get my massage, I feel happier, and I love it, and I go as often as I possibly can. I do think that it helps. My neuropathy is getting better, and I totally believe that the massage is a huge part of that. Walking and the massage, I think, are the biggest two things that are helping me. So Susan is here to teach you guys how it helps from her perspective. I'm just the person that, gets it done to. I don't know like the medical parts of how it works, but Susan's here to tell you guys, and I encourage all of you to consider giving it a try with Susan, or there's another massage therapist here today named Wendy. Give it a try. I promise you will love it. It's not like a regular massage if you've had like deep tissue. This is different, and they're skilled at neuropathy in particular, and you will love the way it feels. So I'm going to let Susan tell you her background and her history. Come up, please. And thank you so much. Thank you. Welcome her warmly.
Hi. Thanks so much. I'm a brand new member of the Neuropathy Alliance of Texas. I'm really, as I was preparing for this talk, I just got really excited about the work that's being done, and felt it was really important for me to join you all. So I'm going to be handing out a handout a little bit later. It has my contact information. If there's anything that comes up today that you have questions about, I'm very open to talking about peripheral neuropathy, and especially how massage therapy can be supportive wherever you're at with that right now. Okay, so I'm just going to introduce myself a little bit. This is a lot of information on this slide. My name's Susan Prins. I'm a licensed massage therapist. I'm also, I have a Master of Fine Arts in Theater Arts, but my particular focus was in dance, and within dance in kinesiology and biomechanics, and I've always had a real fascination with anatomy and movement. So I also do manual lymph drainage, which can be supportive for a lot of different conditions. I use it mostly with my oncology patients who have lymphedema. And I'm a member of the Oncology Massage Alliance. Kim mentioned one other therapist, but actually there are 3 other Oncology Massage Alliance therapists back there. So if you have any questions afterwards, they'd also be a great resource. I put, there's some postcards and some cards back on that back table about the Oncology Massage Alliance. So even if you don't particularly suffer from cancer, there might be things that overlap similar concerns. So, and then there's just a disclaimer. I'm presenting information as I have experienced it. I don't diagnose. I know that you are the experts of your own condition. So any questions related to what causes your peripheral neuropathy would be directed to your doctor or a physical therapist. But in terms of massage therapy, that's something I'm especially passionate about, the nervous system. I work with kids with neurodevelopmental disorders like cerebral palsy. I work with several clients who have peripheral neuropathy, either chemotherapy-induced peripheral neuropathy, diabetic neuropathy, and some hereditary types of neuropathy. So some of this will overlap. Now, I'm going to be giving kind of a lot of information, but we're going to move through it fast, okay? It's nothing like you're going to have to learn it and you're going to be tested on it or anything else. It's just to kind of give a context for some of the experiences we're going to have later. So I will have a handout that I'll give you a little bit later. I just don't want you to be too focused on gathering up information. But anything that has to do with specifics about massage, how to find a capable massage therapist who can work with you, how to do self-massage at home, any warning signals, that's all going to be written down on a piece of paper that you can take home with you, okay? So I am really hoping that for today we can just kind of move through the material. If you do have a question, please make sure you signal me, okay? So for me, it's really important just that you know that part of my framework for thinking about the nervous system in general is an experiential one. So my first anatomy course was called Experiential Anatomy, and we learned about the different body systems through movement, doing movement exercises, working with a partner, and that's sort of what led me into massage over these years. It's kind of ramped up that's one of my main activities now. And I want to recognize that each of you is the expert of your own condition. I mean, we all are. We all have a lot of things that we're dealing with. When it comes down to it, you are the one who knows what you're going through and what you're experiencing. So I might be calling your attention to what's actually going on in your body. I think a lot of times, at least with the clients that I've known with peripheral neuropathy, there can be fear and protection that builds up around it, and so there can be a little hesitancy. What I'd like to do is find a safe way and a safe place to really notice and feel what's going on in your body. So I'm just going to set up some of those experiences. The power of imagery for me is that as we're talking about the nervous system, and especially with anatomy means like breaking things apart and looking at each little part. But for me, the interesting part is when you put it all back together again. So one way that we do that is with imagery. And sometimes just having a picture, some suggestion in your head can do more than actually knowing the exact details. That's part of the reason I just don't want you to be looking at your papers right now. And the communication I put down there because I'd like you to communicate with me if there's something that you'd like. Definitely when you're working with a therapist, it's really important to let them know any changes you feel, any sensations you're having. I feel like it really helps the therapist tailor their massage to you, and that's the type of therapist that you should have. All right, so the fluid body. I'm going to sit down. I'm going to project my voice, but I just want to go through this experience with you. Okay, so the fluid body, I put that up there just because for me that's an important understanding of the nervous system. Sometimes we get a model of it as all kinds of wires that have kind of gone haywire or something like that. But actually, our bodies are so much fluid. There's just, I think, 65 to 75%, depending on how you measure it. Our bodies are made up of fluids. And for me, that offers a way to access change and to really allow an electrical current to pass through, maybe in a new way that you didn't expect. So I'm going to sit down. I'll project my voice, but I'm just going to be asking you to do a little experience with me. Find these chairs are super comfortable, but find a place where you feel like you don't have to use a lot of work. I'm going to rest my hands just right on my legs. I'm not really pushing or anything, but I'm just letting the full surface of my hand touch the full surface of my leg. And just letting my spine feel relaxed. Sometimes it helps me to just move my shoulders a little bit. And then if you're comfortable, I'm just going to ask you to close your eyes. We're such visual creatures that when we take out that vision element, sometimes you can feel the touch sensations a little better. And just take a nice deep breath. And I just want you on the back of your eyes just to remember that image of the fluid body. And I'd like you to imagine yourself as a cell, one cell just floating in the ocean. You're a fluid-filled cell, and you're floating in an immense fluid environment. And I'd like you to imagine your skin just as the semi-permeable membrane of that cell. It can allow what moves out of the cell, what moves in it. And I'd just like you to relax and allow this image of floating in a fluid environment feeling yourself moving and being moved. You might sense your fluid pouring into different body parts, maybe into the side of your head, into one of your shoulders. And in this way, almost like an amoeba, you can kind of float in the currents of the ocean. Letting the soles of your feet feel wide and soft. Maybe just drifting, floating, feeling suspended and supported by the water. And just gradually bring your movement back to stillness. Just notice any sensations that you might be feeling. Notice any thoughts. Just with a sense of curiosity. Just feeling what you're really feeling right now. And if you can, I'd like you to stay in this sensing state of mind as you slowly and gradually open your eyes. And I'm just interested in going around the room and just hearing what, just in one word or two words, what different people are feeling. Would you like to share what your support? Anyone back there? Soft. How about you, Lisa? No? Do you have any word? Support, again. Calm, peaceful. Relaxed. I feel like I could go to sleep. Meditation. Mm-hmm. Buoyant. Tranquil. Relaxed. Calm. Weightless. Peaceful. I see some nods. Anyone here on the front row have a word? No? Anyone else? Great. That's a really great place to start from. And I'm just going to encourage you, even when I'm getting excited and showing you neurons, and I get really excited about the images and the information I'm sharing. If you start getting overwhelmed, just go back in that ocean. You can shut your eyes even. You can just really take care of your state. That's a really great place to start from. Okay, I really loved this. Touch is one of the principal elements necessary for the successful development and functional organization of the nervous system. and is as vital to our existence as food, water, and breath. That's why I'm a massage therapist. I just love it. Okay, so I really didn't, I'm not going to talk a lot about peripheral neuropathy because I really believe you guys have done a lot of research and you have a lot of experience. I'm just bringing it in because that's what our talk is about today. So it's a collection of disorders that occurs when nerves of the peripheral nervous system, which is the part that's outside of the brain and the spinal cord, are damaged. It's most commonly due to damage to the nerve axons, but sometimes the myelin sheath that covers the axons can be damaged. Other times, like with diabetic neuropathy, the blood vessels that supply nutrients to the nerves first start to degenerate, and then the nerve is damaged. And there are hundreds of different peripheral neuropathies, and they arise from different causes. So these are some of the underlying causes. Some are hereditary, some are metabolic, like the type from diabetes or liver disorder, inflammatory, toxic, which I have dealt with a lot, the chemo-induced peripheral neuropathy. You can get it from different chemical exposures, certain vitamin deficiencies, peripheral neuropathy from nerve impingement. Carpal tunnel is one example of that. Sometimes if there's a tumor that's pressing on a nerve, it can cause a type of peripheral neuropathy. And idiopathic is, I think, makes up about 25 to 30% of all peripheral neuropathies, and that just means they don't know what caused it. The symptoms and the effects depend upon what type of nerve has been damaged. So some of those can be sensory nerves, motor nerves, or autonomic nerves. And we're going to talk about what those are and how massage can affect them differently. So sensory nerves tell us how things feel. So that could be texture, could be cold or heat, could be pain. And the way you might experience that with peripheral neuropathy is that you might have numbness, you might have the feeling of having a sock or a glove that muffles your sensation. It could be a shooting pain, a burning pain. It could be that you can't differentiate between heat and cold. Does anyone have experience with those types of sensory neuropathies? Yeah, I see a lot of nods, yeah. And a lot of times the sensory and motor and autonomic can all occur at the same time. So we're just going to differentiate it a little bit, but you can just see if some of this resonates with what you experience. So motor nerves are nerves that come from the central nervous system and stimulate muscular contraction and initiate movement. And if you have peripheral neuropathy that affects the motor nerves, you might feel weakness. It might affect your balance. You might have trouble walking because you can't really control your muscles. You might have a foot that drops that you tend to trip over. You can have difficulty with buttons, especially at least with my patients when they're just starting to get it. That's one of the first places that they notice, oh, I can't really control my fingers. You might get twitching. They're called fascinations, and it's just where the muscles twitch, but it doesn't seem to have an organized reason for it. Do people also suffer from the motor? Do you have a question?
Yes. Like when your muscles cramp, is that?
Cramping can be another, that can be another sign of the motor nerves being affected by the neuropathy. Mm-hmm. Autonomic nerves are nerves that control the functions that our bodies don't consciously regulate. So that could be your breathing, your heart rate, your digestion, and it can affect the internal organs. So it can cause issues with the heart, the bladder, the intestines, and you might feel constipation. You might find dizziness because your blood pressure doesn't regulate adequately. You might have difficulty swallowing or digesting. Does anyone have issues with autonomic nerves? Yeah, so a lot of times it really overlaps. So this is just a picture of the nervous system. The red brain and spinal cord, that's the central nervous system. The peripheral nervous system is anything outside of that. So a lot of the peripheral nerve bodies are actually right along the spinal column, right outside the spinal cord, and they communicate and overlap quite a lot. So even though the division is made between central and peripheral, there's a constant communication between them. And for me, that's really important to remember. We're not just all little pieces. We're actually an integrated whole. So in the peripheral nervous system, it's divided into two main types. So the somatic nervous system is supposedly the part of the nervous system that is under our direct control. So that's also a little bit, there's a lot of overlap there. Sometimes it's under our control, but more often, thank goodness, it takes care of itself and figures out how to help us coordinate our movement and coordinate our sensation. So the sensory nerves and the motor nerves are in the somatic nervous system. And the autonomic nervous system, as I said before, is the part that controls a lot of the inner workings, the organ function. It's hard because sympathetic is a word that we're familiar with in other contexts, and it just doesn't ring with this, but I'm just telling you what it is. Sympathetic is often condensed into the fight, flight, or freeze response. So it's the part of our nervous system that keeps us alert. It can make us ready for action, but a lot of times in our culture, it's overstimulated. So if we're in stress just constantly, if we've got a lot of worries, if we're very busy, that sympathetic part of our nervous system is just always on high alert. And that stress is a cause of a lot of our pain and discomfort. Okay, so in massage, we're actually going to try to induce or access the parasympathetic, which is just a great word, but it's really the rest, digest, heal, peaceful, tranquil place that we just were. Okay, we accessed it through embodiment, meditation, seated open awareness. That's how we accessed it. A lot of you do the Tai Chi class, which I got to look in on the other day. That's another way to access the parasympathetic nervous system. Massage is a great way to really contact that part and support it and build it up. And that's one of the main places where I think massage can be really helpful.
Question.
Yes.
Of these three, when you have a neurologist, can they address, work with you on all three?
A neurologist would be, they would be looking for clues within all those systems. Yeah. So depending on the underlying cause of the peripheral neuropathy, the first order of business would be to find out what is causing it and remove that cause if possible. That's not always possible, but if it's for instance, if it's a toxic chemical source, to remove that. For chemotherapy, it can be difficult because sometimes doses are lowered for that reason, but then maybe it's not as effective. For a hereditary case, it's more how do you manage the pain and the other symptoms. So I'm talking about nerves. Neurons are the most basic cell in the nervous system. They're amazing. In the peripheral nervous system, they can be so thin, but they can go all the way from your foot up to your brain, one cell. The cell body would be along the spine, and then it would have an axon going down to the foot to receive information there. That's the skin receptors in the skin that carries up the information up to the brain, and what the brain does is take all that data and make sense out of it. And part of the issue with peripheral neuropathy is either the information isn't coming in clearly because the axon is damaged, or there could be mixed signals or misinterpretation of what the sensation actually is. So I grew up learning there were 5 senses, and it's just not right. You know, there's vision, but there are many different aspects to vision. There's hearing, smell, taste, and then touch is just a whole world of touch. There are individual touch receptors for the different types. Some are activated by, well, I'll show you some. Merkel's discs there in purple. They're really discriminating small, close to the skin receptors. They're the ones that do the most fine detail. When someone who's blind reads Braille, it's those Merkel discs that are receiving that information. If you take that away, or if you only stimulate the Ruffini's corpuscles, you wouldn't be able to discern. You could feel something, but you wouldn't be able to discern what is that actual texture. Some, like the Pacinian corpuscle, it activates when the pressure first goes on, and then it stops, and then when the pressure changes, it stops. So it doesn't bombard the brain with too much information. And so there's heat, cold, vibration, all different types of information is coming in from different sources. And so it's a really complicated, complex system. So nerves, as we know them, are bundles of neurons. You can see that there are some blood vessels in there also. There's connective tissue holding together. You can have sensory information which goes from the periphery to the center in the same nerve as a motor neuron going from the central nervous system out to the periphery. It's really packed in there together. Now this is I kind of like this picture. It's got a lot of stuff in it. The different colors along the spinal column on the left are showing the different divisions of the spine. So the sacral nerves, the lumbar nerves, the thoracic is the middle, which corresponds to where the rib cage is. The cervical corresponds to the 7 vertebrae in your neck. Each of those has dermatomes, which are sort of the skin area that they feed. So that'll help. That would give a neurologist a clue of where your specific peripheral neuropathy is affecting you. Now, as the message, if you can imagine that the message is coming in from that foot and going up the spine, goes all the way up to the brain. I know you're very curious about that homunculus there. So don't worry, because I made a copy of this for you to take home and look at more carefully. It is really amazing. In our brain, these are just kind of sideways pictures, lateral views of your brain and the cerebral cortex. Right along the midline here, going out from the center to the side, we have this mapping, sensory mapping. And I'm going to look at the somatosensory. That's the one that receives the information and makes a map according to where you're getting the most information. So the neurons there are more densely packed, as you can see, for the lips. The index finger is densely packed with sensory information, and less for the foot, less for the arm. So you have more feeling in those areas, your lips. Then the one next to it is the motor, and it's a little off the screen, but you can still see that there's, in this case, it's the thumb. Well, the thumb normally has more motor nerves. It's got more, what's the word for that? It has more work to do. It has more different ways that it can move and operate. It needs more specific information in order to use tools. And then it's not written there, but there's a lot for the voice, the larynx, the tongue. Yeah, so I think I covered this already, that the sympathetic is the fight, flight, or freeze aspect, and the parasympathetic is the rest, digest, and heal. Now, these are not antagonistic parts of the nervous system. They work together towards homeostasis. They want your body to be in a balance. They don't want you just to be zoned out all the time. The reason that massage is really supportive in inducing the parasympathetic response is because in our normal life, we spend so much time in that high alert and high stress. Okay, so it's not that that's a bad state to be in because we need it to function, but they work very closely, very closely. So that was just a little bit about peripheral neuropathy and the nervous system. And what is massage? I put up there the whole Texas code of what massage therapy is. It's a lot of words. It's a lot. Okay, so I'm just going to skip over that. It tells what it is and what it isn't. But I really love Gail McDonald. I just did a class with her. She teaches and writes about massage for the cancer patient. And she said, massage is any form of systematic touch. Okay, it's if you do it with yourself, it's if you do it with a friend, taking care of a partner, if you go to a massage therapist. It's something where it's intentional, mindful touch. Okay, that's the way I'm using it. Okay, so there are many different modalities. There are many that are very popular. Some of them are not appropriate for peripheral neuropathy. So I'm going to talk about which ones are. So there are a lot of benefits for massage, and I don't think it can be denied. There's really a big space waiting and kind of absent right now for evidence-based research, although it's really picked up in the last 10, 15 years. It's a hard thing to measure because there are so many different things to measure: the duration, what type of touch, what type of training the therapist has, and it's hard to divide that out and then get control groups and things. So there's kind of a move for that because I think there's been more of a move of massage into the medical world, but a lot of the effects that are well known are not really proven, but it does enhance relaxation. That's largely because of the parasympathetic response. It can reduce stress. It can relieve pain and especially muscular aches. It can encourage greater ease of movement. It can increase the overall body awareness and sensory mapping. Just having someone touch can improve your awareness of what's going on in your body. One of the resources that I was listening to talked about an experiment with monkeys that are very similar to humans, where they stimulated an area on the finger for something like 5 hours for 3 weeks, and the sensory mapping for that area increased by four times within 3 weeks, just by stimulating it. It can improve sleep, and that can be very, very helpful also in the healing process. And it can keep the skin moisturized and healthy. Yes?
One item see up there is to increase the blood circulation. Is that?
Yeah, I didn't include that because it's something that is being debated right now. There is not really speaking of evidence-based research, there's not evidence-based research that it increases circulation, or at least it hasn't been defined as to what type of circulation, how much, how to measure it. I think it has more to do with a lack of technology of how to measure fine increase in circulation. So that's so interesting you brought that up. I didn't put it up for that reason, but you will see it in general all over many organizations that deal with massage will say it increases circulation. But yeah. I'm going to take that as a example of you knowing your own experience. Yeah. So what type of touch is best for peripheral neuropathy? I wrote listening hands. And what does that mean? Yeah, so I just want you to take one hand and put the other hand in it, just resting in it. I'm going to wrap my thumb actually just onto the palm so I can feel the front and the back of my hand. And if you're comfortable, you can either rest it in your lap or just somewhere where you're not feeling a lot of strain. And if it helps you to shut your eyes and just take that visual element out. I guess when I say listening hands, I mean noticing. Might notice the temperature. I might notice the weight. I might notice the contours. If you want to move your hand also, you can move it and listen also. You can listen from a different angle. It's really being curious and aware. Okay, so you're touching yourself, so it's a little hard to make this distinction, but not only the hand that's touching, but the hand that's being touched should both be listening and being present. Yeah, and I expect that might bring more questions than it answers, but that's my answer for now. So I'm going to show a slide in a minute discussing the Walton pressures, but in general, for peripheral neuropathy, deep tissue massage is not helpful. It can be damaging because in the areas where there's impaired sensation, you're not able to tell your therapist, hey, that's too hard, or even feel it yourself. So in general, it's better to use a gentle pressure. Slowing down helps a lot. In fact, I think slowing down to just full aware holding can be a really transformative experience. I don't think we do it very often. But when you're moving, really moving consciously and slowly so that you can feel the changes in your tissue. The direction of the strokes can really be supportive if you move from distal, which is at the ends of your limbs, towards proximal. So that doesn't mean that every stroke has to be that way, but just that you're aware that the energy is moving towards the center. For me, a fuller mental picture helps, and that's partly why I wanted to share those some slides about the nervous system, because for me it really helps when I'm offering someone a massage and I'm working on their foot. It helps me to know that I'm connected to their head, because it opens up a line of communication. Yeah, I was telling Jerry a story of one of my clients in the infusion room at Texas Oncology who he was a little reluctant for a foot massage. I don't think he had ever really had a foot massage. He said he didn't really have much sensation, and his daughter said, no, go, get a massage. It'll help you relax, Dad. And he's like, I'm relaxed enough. And so I said, well, if you don't feel that it's helpful, or if you don't feel comfortable or you don't like it, just let me know right away and I'll stop. But if you're willing to give it a try, we'll give it a try. So I started very slowly. I was just gently stroking. And most importantly, I had this very clear idea of the fluid body moving up and towards his brain. But I wasn't talking about it. And all of a sudden he sat up and he said, what are you doing? And I said, oh, excuse me, are you uncomfortable? He said, no, not at all. He said, I'm feeling some things I've never felt before. And I said, okay. He said, I really want to know what you're doing. Because I was basically just holding his foot at that moment. And I said, well, if you really want to know, I'm preparing for my talk with the Neuropathy Alliance, and I'm just really excited about this idea of the electrical charge passing through the fluids from the foot all the way to the brain on one neuron. And he said, oh my gosh, he was a retired orthopedic surgeon. And I don't think he was expecting me to say that I was thinking about neurons, but it was really effective for him. So, yeah, for me, whether I'm working myself or with someone else, that a fuller mental picture can help. And then care or self-care is really crucial, that we really approach it from not trying to fix something, but really caring about what's happening. Self-love is really important. A tenderness, yeah, whether it's someone that I know or not, I always approach my massage that way.
Another question.
Yes.
Yeah, when you were holding this person's foot, you had the sensation of
Mm-hmm.
energy. Was that his own energy, or were you transferring some of your energy to opening up and creating blockage?
That's a good question, and I'm not sure about the answer for that. Yeah, he asked when the man that I was working with had the experience of energy moving, was that his energy or my energy? And I guess what I feel with touch, that I don't feel that I'm passing my energy. I feel more that I'm listening and observing. And so it's more like a matching of attention. We're both paying attention to the same thing. He was aware of what was happening in his body, and I was aware of what was happening in my body too, but I wasn't trying to act on him. Yeah, just trying to help guide his attention into his body in a clear way. Okay, so this is hard to read, but the picture on the side is one that I included in your handout, which I'll be giving you in a minute. It's just a way to measure pressure, and it's one that we use in the Oncology Massage Alliance. In fact, across oncology training, it's used. So it was developed by Tracy Walton, who's an oncology massage therapist. So I'm just going to read pressure 1, or sometimes they even say 0, is just either right off the body or just a very light touch. If you're moving your hand, it's like putting on lotion, just lightly rubbing on a light lotion. It's just right on the skin. It doesn't really move the tissues much. It doesn't have to move fast. It could just be lightly resting your hand. Level 2 is heavy lotioning, so that's when you're actually like rubbing some lotion in where you want it to absorb a little bit. So it moves a little bit the adipose tissue there, the fat right under the skin, but it doesn't really move the muscle tissue very much. And then 3 is medium pressure, and that can definitely, especially with a squeeze or a compression, can get into that muscle tissue. Or if you're maybe using your thumb on your finger, you might get the muscles there are quite thin. So we're going to stay within Walton level 1, 2, and 3 when we're working with peripheral neuropathy in general. And just for the reason that I told you before, which was that it's really hard to sense what's going on. And those levels of pressure are very powerful. It is one reason if you go out to a massage therapist who doesn't have a specialized training, that's one thing that you would want to let them know, that you need a gentle pressure.
Swedish massage?
Swedish massage is a specific type, and it's used in Texas as the baseline for licensing and for training. Swedish massage does have a circulatory intent, so it's really about moving, kind of kneading the tissue and moving it. And if you went into a massage clinic and you said a Swedish massage with a very light or a moderate pressure or a light pressure, then that would be, maybe a 2. Different therapists use a different amount. Right now, what I see as a danger is that there's a just with the widespread popularity of massage, which I think is very positive, there's also a little bit of a feeling of a hierarchy. And in many places, you'll find deep tissue is the real massage, and Swedish massage or lighter massage is not the real massage. And it's hard to counteract that. And so you have to go in a little bit educated and ask for what you want. You want a slow massage, a detailed massage, and a lighter pressure massage. Yeah. It doesn't necessarily have to be Swedish, but it has to be those things. So these are some cautions also. So also some massage therapists just really like to do joint movements. They might, do this move and get under your shoulder blade. And so that's something to be really cautious about. For the same reason, if you can't feel that movement, you're putting that joint in danger. So that would be something to watch out for. It's really important to inspect the skin carefully. I'm talking about feet and hands because largely that's where things start. You probably would notice things in your hands first, but a lot of people, if they're losing sensation in their feet, don't necessarily get a chance to look. But massage offers a really good chance to inspect between your toes, see if maybe you've stepped on something and you didn't feel it and it irritated your skin. Any kind of fungus or something like that might affect your overall health. It's really good to take that chance to look. It may be difficult to give accurate feedback, so I encourage you as much as possible, if you're with a massage therapist or with a loved one, to really communicate as much as possible. If you experience a sharp stabbing pain, make sure you stop what you're doing. It's definitely not no pain, no gain. If you feel something that really gives you a warning, I encourage you to check it out with your doctor. And then the other caution, which is hard for me as a massage therapist, is that massage can reduce your pain and increase your well-being, but it can also aggravate certain things. If you have edema, you have to be very, very cautious. It can increase the inflammation, so you just want to make sure you go extremely gently and extremely slowly. It can also, I've worked with a woman for quite a while now, and she has chemo-induced peripheral neuropathy, and sometimes even though we both understand that we're working slowly and gently, it can activate it. And she will laugh about it, but I don't really like that feeling of, okay, by bringing my attention here, that now I'm feeling more tingling or more burning here than I started out with. So that's something that's going to be different for each of you. So that's just something to maybe chart. One suggestion is to maybe keep a journal and just what which part of your body might be feeling a change of sensation or feeling some pain, what words you would use to describe it. Yeah, exactly. So that's why a journal sometimes is just a little helpful. Make a little note, see what happens, see if you can find a pattern, and see what things can help make it better. So to find a qualified massage therapist, clinical knowledge I think is very helpful, and experience. Compassion is, that seems like it should go for anyone in the massage therapy field, but I find it especially helpful for this type of condition. Safety consciousness, so that's someone who really will take the time to inspect your feet, make sure that that the room that you're in doesn't have hidden dangers that you might trip over. And the ability to provide a detailed, gentle massage. So you do want it to be detailed, and I'm going to give some examples of what that would look like, but gentle goes along with that. And also a collaborative attitude where you can work with the therapist over time, hopefully. So these are two great resources, and I've got it also in the handout. You don't have to write it down if you don't want to. The Society for Oncology Massage has an online list. You can look for a therapist in the Austin area, and you'll find all of us. There's some others too. And the Oncology Massage Alliance, we all have training in oncology massage and how to do a gentle massage. So the guidelines for massage at home, just to make sure you make time for it and give yourself time. I've got it at the top of the list and the bottom of the list, so time is an important part. Making sure you choose a comfortable place, and if you're getting a massage from a caregiver or giving a massage, make sure that both of you are very comfortable, okay? That someone's not leaning in an awkward position trying to help you feel better. To do that, you could have pillows, blankets, any kind of support. Really take a few minutes to not just say, oh yeah, I'll just lean back here on the couch. Make yourself fully comfortable. There are a lot of different positions. You could be lying sideways in your bed. You could be sitting in a chair, as long as comfort is taken care of. Just communicate. Let your partner know what feels good to you. Make sure you have permission. And then quality of touch is sort of the listening hands, but also the way that you start to touch and take your hand away can be part of the key, I think, for whether you activate those uncomfortable sensations. For me, it reminds me a little bit of ticklishness. I worked with a gentleman this morning who has ticklish feet, and he said, oh, you're one of the few people who I can let touch my feet. And I said, I think it's because of the way that I'm just taking my time and I'm not moving too fast. I'm letting your body adjust. And I believe that that's really similar to the way that I approach my work with peripheral neuropathy. It's like, you don't know what's going to happen, so take your time, listen, and just be with it as it is. Sometimes there's a lot going on under the skin and under the muscles, and the person that's just holding is just noticing and being present with the other person. And take your time. Okay, so I have this all written out. I'm going to pass out some handouts right now. It's just it says feet. The same principles apply to the hands. It says up to the knee. Really, you can follow the same principle up to the neck. So it's just a guideline, basically. Let me pass these out. So I think my time is about up. I'm just going to orient you to my handout, okay? So some of this we saw exactly in my presentation about the benefits of massage, what type of touch is best for peripheral neuropathy. And here where it says Walton, pressures 1, 2, or 3, on the 4th page, there's just a little reminder there showing what the Walton pressures are. I wrote the massage for peripheral neuropathy cautions, the things to watch out for, what to look for in a qualified massage therapist. And on the back page, not the back page, sorry. The next page after that, you'll see the link for the Society for Oncology Massage and the Oncology Massage Alliance. The second page of your handout is this that's up on the screen now, but it's written out 1, 2, 3, 4, 5, 6, 7. The third page is some different resources, the Neuropathy Alliance of Texas. I do want to say, I didn't get on there and watch 500 videos, but I did watch all of them. They're really good. It's a great archive, great resource of all different topics. Also, the Foundation for Peripheral Neuropathy has some studies, if you're interested, and some other interesting information. And then I just put here some of the resources I use. Some of them might not be interesting to you. They might be technical. But I do want to point out this last one, Understanding the Secrets of Human Perception. is a great course audio recording that I found at the Austin Public Library. It's fascinating. He's a great teacher. It's got something like 15 lectures or 20 lectures. I don't know how many lectures, but each one of them is just fascinating. So if you're interested in the nervous system, that's a great one. And the one above it, Touch, The Science of Hand, Heart, and Mind, is a recently published book really talking about neuroplasticity and how much recent research there is that our brains are constantly able to change and renew. For me, that gives me a lot of hope for people with peripheral neuropathy, because I really do believe that the body can relearn and repattern, and even if nerves have been damaged, that there can be hope for some relief. So my name is at the bottom of that page, and it's got my email address. So if there are any questions that are not addressed today, you're welcome to send me an email. I'm happy to talk with you about it. And I did put the homunculus here on the back because I just, you know. So I want to say I really appreciate you all being here. It's really been lovely speaking with you, and I'd love to answer any questions if you have any.